This next section is entitled Thyroid Medications. We'll discuss medications commonly given to patients with both hyper and hypothyroidism. In this section, we'll discuss thyroid medications. Thyroid hormones T3 and T4, which are produced by the thyroid gland, are very important determinants of normal development in humans. They also help to maintain metabolic homeostasis and affect every organ system in the body. T3, or triiodothyronine, is the most active form of thyroid hormone. T4 is more abundant in the plasma, however. Usually this is converted to T3 peripherally. 90 to 99% of the hormone in the plasma is bound to different plasma proteins. The TSH level, or thyroid stimulating hormone level, is the best screening test for thyroid dysfunction. The thyroid hormone cascade starts in the hypothalamus, where TRH, or thyroid releasing hormone, is released. This causes TSH to be produced by the anterior pituitary gland. TSH activates the thyroid gland to produce T3 and T4. T3 and T4 go into the serum and attack target organs and create changes for development. T4 is converted to T3 peripherally and in the liver. The treatment of hypothyroidism in patients that aren't producing enough thyroid hormone is very straightforward. Generally, these patients are simply given T4 or Synthroid, which is a synthetic thyroxine. These patients are then monitored in terms of their TSH to make sure they're receiving the proper dose of thyroxine. Patients that have primary hypothyroidism can develop certain features. For example, these patients usually develop puffy, dry skin on their face after a long period of time. The sign of Hertoge is when the outside component of the eyebrow is lost. This is a sign of hypothyroidism over a long period of time. These patients can also have brittle hair and hair loss, as well as weight gain. Mixed edema is a confusing term which can be used to both hypothyroidism and hyperthyroidism, but is used to refer to different things in each one. Mixed edema coma is usually used to refer to hypothyroidism, and it refers to the CNS and skin changes of that disease. Pretibial mixed edema, however, can be seen in hyperthyroidism from Graves' disease or Hashimoto thyroiditis. Both of these conditions are related to changes in extracellular matrix protein synthesis in the thyroid disease and or immune complex deposition. So the term mixed edema can be very tricky to understand. It's important to remember that they can occur in both hypothyroidism and hyperthyroidism. In hypothyroidism, mixed edema coma is associated with generalized apathy, sluggishness, listlessness, and it's related to mucopolysaccharide-rich edema that accumulates in skin and other tissues. It can cause coarsening and broadening of facial features. For the treatment of hyperthyroidism, this can be much more difficult. Hyperthyroidism can be caused by either Graves' disease or some type of thyroid tumor or overactive thyroid gland. The management sometimes involves PTU, or propylthiouracil, or methimazole. It can also involve iodide therapy, which is non-radioactive. It can involve radioactive iodide therapy, which causes ablation of the thyroid gland. It can also involve surgery. Here's a patient that has hyperthyroidism. On the left, you can see that this patient has severe exophthalmos. After treatment of her Graves' disease, you can see that her eyes return back to normal. This is a patient's leg and foot, and you can see that right in front of the tibia, this patient, because of prolonged hyperthyroidism, has developed pretibial mixed edema. This mixed edema is associated with hyperthyroidism. For the treatment of hyperthyroidism, these patients usually have excess thyroid hormone, which causes upregulation of beta-adrenergic receptors as well. This can cause tachycardia, tremors, and anxiety. These patients should receive beta blockers. And usually they need a non-selective beta blocker because both beta-1 and beta-2 receptors are upregulated. Thyroid storm is a condition where a patient with hyperthyroidism exhibits a very acute elevation in their body temperature that's associated with their hyperthyroidism. This is considered a medical emergency, and it can be associated with multiple causes such as infections and surgeries in patients that have hyperthyroidism. Patients that have hyperthyroidism are usually treated with antithyroid medications, such as PTU, propylthiouracil, or methimazole. These medications are inhibitors of the enzyme called thyroid peroxidase. Thyroid peroxidase is responsible for linking iodine molecules to the thyroid hormone. This is a process called organification. These medications work, but usually very slowly. They're often used as main therapy or prior to surgical treatment or radioactive iodine. They can also cause agranulocytosis as a side effect, usually one in about 500 individuals. Thioamides are able to cross the placenta, however, PTU is considered to be safer in the pregnancy because it doesn't cross over to the fetus as often. Both of these drugs are much safer to the fetus than either giving iodide or radioactive iodine while the woman is pregnant. Radioactive iodine is effective at ablating the thyroid. A patient with hyperthyroidism that receives radioactive iodine can have their thyroid gland ablated, and then after having the thyroid gland ablated can go on Synthroid, or a synthetic thyroid hormone replacement therapy, for the rest of their life. Radioactive iodine should not be given during pregnancy because it will also destroy the fetal thyroid gland, and that fetus will then be hypothyroid for the rest of their life. Iodide itself, which is non-radioactive, is the oldest remedy we have for thyroid disorders. The way that it works is by reducing the gland's size, fragility, and vascularity. Often it's used as temporary treatment as a bridge to surgery. This is also contraindicated in pregnancy because it can cause neonatal goiter. Iodide also can cause hypersensitivity reactions. It can taste very funny. It can cause burning of the mouth and gums. Importantly, you should remember that amiodarone, which is a medication commonly given for arrhythmias, can cause both hypo and hyperthyroidism because it resembles thyroid hormone itself. This concludes our section on anti-thyroid medications. This is also the conclusion of the Falcon Physician Review's USMLE Step 1 Pharmacology Review. Thank you very much.